Okay, there we go. Ready, ready. Okay. Hello, everyone. Good morning, good afternoon, or good evening. It depends when you are watching uh, this video about the um, interesting uh, topics in orthodontics. Um, I hope are you fine? I hope you're okay. Before I begin, let me introduce myself. I change my position, please, because you need. Okay, perfect. Um, Before I begin, let me introduce myself. I'm Dr. Ronald Ramos. My nickname is Dr. R3M. It's like it's because my beginning letter of my name is RRRM, Ronald Roosevelt Ramos Montiel. So it's simple. It's just like this, Dr. R3M. No more. Uh, um, I am research professor of the Universidad Católica de Cuenca, with a focus on a diagnosis and treatment of head and neck disorders. Um, During my life, I have had some academic grades, like general dentist, superior certificate in integral dentistry, specialist in orthodontics, specialist in clinical teaching and dentistry. Doctor of Dental Science, it's equal to PhD grade. And the last grade is the postdoctoral in research in engineering and innovation. It's PT. So it's not so important for me, but because my best academic grade is to be your professor today. Okay? I hope that you enjoy this video. Okay. It's very important. It's very, very important that you know this topic in Orthodontics 5. Today, let me introduce you to a very beautiful topic in my 5. The topic is model analysis. It's very important because, okay, you have treatment in orthodontics, you have diagnosis in orthodontic, but why do you do teeth analysis? Uh, how do you have diagnosis in orthodontic? It's very important, the model analysis. However, it's important that we start be knowing the habits, because this could trigger alteration in occlusion, and in turn, this will need to be diagnosed. So, what are habits? Because it's important that you know what is the habits. The habits are bad. The habits are good. Hmm? What happened? Okay. No problem. You have in the Spanish language some concept. For example, la Real Academia de la Lengua, uh, to mention that the habits uh, are special ways of proceeding or behaving acquired by repetitions of the same or similar acts, or originated by instinct tendencies. On the other hand, we have in English the main posture about the concept is there is the Oxford Dictionary of the English language, which mention habits such as and establish the position or tendency to act in certain way, especially the acquired by frequent repetition of the same act until it becomes an involuntary involuntary act. So it's very important that you realize this concept because the question is clear. So in dentistry, are they harmful? Mm, 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 mm. Yes and not. Wow, the question is worst because yes and not. What happened? What happened here? Okay, let me explain this concept that yes and not. Because in dentistry, you have uh, physiological habits and harmful habits. Okay, the, the physiological habits, it's very important because the physiological habits like breastfeeding, it's important. Clear concept could be is one the physiological habit that it's not only natural but also always the core growth and development. It's very important for the growth and development of the child from the birth to childhood. It's very important. It also allows the development of the child with his environment through the senses, like six, hearing, touch, smell, and taste. If the children knows the environment and interacting with development, the growth and development of the child, it's good. But if you put some some uh, object like a finger or artificial breastfeeding, uh, you eliminate the, the control of the growth and development in the boy, in the children. For that reason, you have the harmful habits. The harmful habits, on the other hand, it's like the habit, the pernicious habits, like thumb sucking, baby pacifier. It's controversial, the concept of the baby pacifier, because you can see in United States or any city or around the world that the baby uses baby pacifiers, but why it's bad to use that baby pacifier? It's because when you use this pacifier uh, after and before the time of the feeding, you have a problem with this use. Lower lip sucking is another bad habit. Atypical swallowing, mouth breathing, and onychophagia. It's like uh, many, uh, but you have more harmful habits. So, and then this habit that if you have this habit, could be developed another situation in the stomatognatic system. For example, the development of these harmful habits will affect the growth and development of children, resulting episode of severe dental crowing, like this picture, so which is also known as a back as a back of space for proper eruption of teeth of the permanent teeth. It's important because you can see many child with this condition in your mouth. So another situation very important is when this dental crowing is easily observable on the face and is known as adenoid facies. And this is a complication of interdisciplinary treatment. You can see some clinic characteristic that the children, uh, normally the professionals in the health area, to mention that this syndrome is cause allergy or adenoides glands or another situation. But the main problem uh, could be in the stomatomatic system. If you want, if you want this condition, you need to know all the condition in the stomatomatic system. For that reason, my field to research is Hellenic, the disorders and treatment. Okay, continuing with that. The new question is, how can the problem quantify? How can you, how can you quantify the problem? Okay, yes, of course. Through the evaluation of the models in orthodontics. It's very important that you know that. So, to beginning with this, the mixed dentition analysis to begin sometimes uh, um, in the literature you find this name Rakosi. Rakosi um, evaluate the support zones in the models of the children. And then in the another researchers to begin the investigation in the mixed dentition period, and then um, to evaluate the discrepancy between available space and space required for eruption of the premolar and canines. In in other words, the first research it was uh, growth or not growth in the mixed dentition. And then um, the people realize that the condition, that condition, it's not important. It's the most important how eruption canines and premolar because this did eruption last time. So the I sorry, yeah. For that reason, and last time, the condition combined the radiographs and predictive tables. This was the most potent uh, evaluate method for to know the growth or not growth in the children. For that reason, you can see the most commonly used are to start as predict tables. It's very important so that you know the factor causing the variation because it's important that the you know the methods of diagnosis, but it's the most important that you know when you can use this method of the predictivity for that you know the space that you need for canines and premolar. When you don't, when you can use this assessment of models is when you have interproximal caries, misaligned restoration, dental anomalies of size, dental anomalies for number, uh, among others that they complicate the size of the teeth. And then you can see in this picture some values about the measure of the canine premolar, first premolar and second premolar. This measure was changed with time. The However, the measure was relative improvement. So we found a good dentition analysis in mixed dentition. It's Moyer's. Who is Moyer's? Moyer's was a research that found the table of prediction is the most used method. Is very important that you know the Moyer's found an interesting way for to find the grow or not grow in the chart. So it seeks to predict the spice that exists in the arc for the correct alignment of the canines and premolar. Um, with they use the card predicting or table predictors. Okay, what do you need for to do that? So you need plaster molders, 2-pointed compass. And I'm right. I don't know if it's right. Compass. It's it's a it's a worse word. Okay, millimeter ruler and the table. That Moyers. Okay, we have we have 5 steps for this analysis. The first step is you need to know the width of each uh, of the 4 permanent lower incisors. So you need in the model uh, size measure the incisor, the central incisor and lateral incisor, and the same situation in another side. And then you will need to add this fold together and get a value. Okay. For example, the central incisor, it's named 41 in the right side. The lateral incisor is named 42 in the right side. So if you measure, you have 31, 5.5 millimeters, 34, 2, 6.5 millimeters, 4, 1, 5.5 millimeters, and then for 2, 6.5 millimeters. Its result of this is 42 millimeters. So you have the measure of the 4 lower incisors, permanent lower incisors. Yeah, the next step is the virtual alignment of the incisors. For that reason, you have 31, 32. The measure is 12. So you put this measure in the compass, okay? And you will be the vertical alignment of the incisors. For example, you have 12 millimeters, so you open the compass 12 millimeters, the one point in the line, the middle line, and another point in any place of the compass, and the same procedure in the another side. You put a point in the other point of the compass, and it's ready the second step. And then you measure space from the new point to mesial of 6 or distal of 5. The teeth, it's named for numbers. For example, 1, 2, 3, 4, 5, 6. For that reason, the measure that you should measure is the point to the mesial of 6 or distal of 5. Okay? What happened here? It's okay. When you are this, when you when when you are this, do you have sorry, you have a new space. This measure of space, this space will be called available space because this space contains the volume available to align two groups that canine and premolar teeth. It's very important because you uh, align central incisor and lateral incisor. Okay, you only have this space for alignment in the future premolar and canine group. Okay, and the next step is the predict to combining measure distal side of upper and lower canines and premolar using the probability type tables or cards. This is the cards or table, the probability. So what do? Okay, this measure is uh, it will this measure will be called required space. How do you do that? You have the table, a percentile, okay, for boys and for girls, yeah, and also you have the boys maxilla measure and mandible measure, and girls maxilla measure and mandible measure. Okay, you choose in the 75 of the percentile because we are Latin America people. So this table was to do for North American England people, among others. But Latin America is a mix of the people. So you choose percentile 75, and then this size in the upper in the table is the space that the measure of the four incisors, permanent incisors. Do you remember? Uh, Let me remind you. This this space, this measure, 24 millimeters, is the number that you need find in the table. 24 millimeters. Let me find with you. Yep. So if you are working with a boy in the maxilla, you choose 75, the percentile, and 24 millimeters, you need 22.5 millimeters for the canine and premolar groups in one side of the maxilla. It's right or left, no problem. It's the same measure, okay? And then the last step is the find the discrepancy. For that reason, you should you should uh, you should eliminate or contrast the required space with available space. You you will have the discrepancy. That discrepancy would be positive and negative or zero. When happens that, okay, in this example, let me explain you. For example, if you have required space uh, less to available space, the dental discrepancy will be positive because you have the most you have more space that you need. Another example is if you have the required space, more required space than the available space, your dental discrepancy will be negative because you need space for aligning of the dental arc. And then finally, if you have, sorry, if you have uh, similar values, similar measures in the required space with available space, um, you will be zero or null. Okay. Sorry. Okay. Continue. Okay. Hands on. One example and one exercise for your work. Okay. Imagine that we have this patient. Okay. This patient is a patient with bad growth, bad development. This patient, allergic patient, that you need, that the patient, you need choose a treatment for this patient. Okay, so okay, the first step, if you remember, to you need the size. Okay, that the central incisor, lateral incisor is the left side and the right side. Okay, uh, it's all is equal 24.5 millimeters. Okay, I uh, I find the first step, and then we have another step. Is the two step. Okay, we are the vertical alignment of the incisor. Okay, and so my teeth uh, was here, and alignment is here. My teeth was here with alignment. It's here. So the compass, it's open with the alignment, the vertical alignment of the measure of the two teeth. We will do in future the same procedure in other side. Okay. Only we are working in one side of the arc, of the dental arc. And then we have the third step. Okay. So we put a point or a spot in the new contact of the compass, and we measure the space from the new point to mesial of 6 or distal of 5. Okay? The space is 17.8 millimeters. It will be available space. This available space is the space that I have for alignation of, for aligning to canine and premolar groups of this side of the dental arc. Okay? And then I use the cards. I use the table that predict. Okay, you have, as I explained you uh, lately, um, so you have a boys or girls. We are working in the maxilla, not mandible, because if you want working in the mandible, you have another measures, okay? I cut the mandible measures and only we are working in the maximum. Yep, okay, we will continue. So I have measure of boys and girls. Okay, the measure is 24.5 millimeters, 24.5 millimeters, okay? And 75 of percentile probability. Yep, I have the measure for boys or girls, okay? Or girls. But for this example, only we are working with a girl, okay? You can work with a boy in any time. Okay, so for that reason, the girl, the size, the measure is 21.8 millimeters. Okay, the last step is required space, 21.8 millimeters, and over available space, 17.8 millimeters. The result is um, 4 millimeters. Positive or negative? Yeah, negative. It's a dental discrepancy negative because I need more space that I have. Okay. For that reason, in the treatment or the planific in the diagnosis, I will need the space. Okay. So we have another model analysis that you can use in the dentistry. Is it's easy, really. Um, you can eliminate 3 steps that Moyer analyzes. So is the Tanaka Johnson. Um, it's simple. Eliminate the need of table. It's based on formulas. You have 2 formulas. One formula for the upper arc and one formula of the lower arc. It's simple. The upper arc is this formula and the lower arc is this. It's the same. The one difference is the number or measure of that you need uh, that you need in your form. Okay. For example, it's here. MD is the measure mesiodistal, the lower incisor. If you remember, it was 24.5 millimeters over 2 plus 11. It's equal required space or the measure the canine and premolar groups. Okay. Let me uh, eliminate the questions. Uh, okay. Only change the value and you have space. Okay. And the result could be positive, negative, or 0. Okay. Okay. To practice at home, I will. No, I hope that you are understand me these exercises. Uh, I I'm sure that it video it's great for you. I'm sure you will be practice a future. However, I hope you use these follows to practice at home. For that reason, um, take a picture this uh, take a picture this image and please practice in your house and change chip for the diagnosis and treatments in orthodontic because our patients are very important. Uh, it's very important that you every time it's practice so many methods of diagnosis and treatment and in pathologies or alteration on the head. So thank you for your attention, and I and I take you the some cards for to practice in the code. Please practice in your house. All right. See you soon. See you.